Here's a question-style format for frontotemporal dementia, FTD, in the style of the medical revalidation of Puerto Rico. Question. A 62-year-old man presents to the office with his wife due to a 2-month history of abnormal behavior. His wife reports that he has become withdrawn and spends most of the day inside, whereas he was previously very sociable and independent. She states that he has been swearing at strangers, has become less affectionate, and has increased impulsivity, including excessive eating and alcohol consumption. When questioned, the patient does not believe that his behavior has changed. On examination, he is alert and oriented, but he frequently swears during the consultation. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Frontotemporal dementia. C. Lewy body dementia. Vascular dementia. Correct answer, B. Frontotemporal dementia, FTD. Why not the other answers? A. Alzheimer's disease typically presents with progressive memory loss rather than behavioral changes as the initial symptom. C. Lewy body dementia features visual hallucinations, Parkinsonism, and fluctuating cognition, which are not present in this case. D. Vascular dementia presents with stepwise cognitive decline and focal neurological deficits, e.g., hemiparesis, sensory loss, which are absent in this patient. Would you like another? Here's a question-style format for frontotemporal dementia, FTD, incorporating pathologic findings such as PIC bodies, hyperphosphorylated tau, and ubiquitinated TDP-43. Question. A 58-year-old man is brought to the clinic by his daughter due to progressive personality changes over the past year. She reports that he has become socially inappropriate, frequently making offensive remarks, and exhibiting hyperorality, excessive eating, chewing on objects. He has also lost interest in his hobbies and no longer expresses empathy toward family members. His memory is relatively intact, but he demonstrates poor impulse control and disinhibition. MRI of the brain reveals atrophy of the frontal and temporal lobes. Which of the following pathologic findings is most likely present in this patient's brain? A. Eosinophilic cytoplasmic inclusions of opssynuclein. B. Neuritic plaques and neurofibrillary tangles. Round cytoplasmic inclusions of hyperphosphorylated tau. D. Perivascular lymphocytic infiltration and demyelination. Correct answer, C. Round cytoplasmic inclusions of hyperphosphorylated tau PIC bodies, or ubiquitinated TDP-43. Why not the other answers? A. Eosinophilic cytoplasmic inclusions of alpha-synuclein Lewy bodies, seen in Lewy body dementia and Parkinson's disease, which typically present with visual hallucinations and Parkinsonism, not primary behavioral changes. B. Neuritic plaques and neurofibrillary tangles, seen in Alzheimer's disease, which presents with early memory impairment rather than behavioral disinhibition. D. Perivascular lymphocytic infiltration and demyelination, seen in multiple sclerosis MS, which presents with relapsing remitting neurological deficits, not primary behavioral and personality changes. Would you like another FTD-related pathology question or a different neuro